Today we're going to be talking about one of the hot topics of our profession, and this is socket chill. Well, the thing is that since Marcus Erzler went through this technique and brought it to us, well, it changed completely everything that we knew about socket management, and it changed it for good. We believe strongly in that. And really, what we are bringing you here today are some of the details that you can add on this, like add-ons, like a plus, that you can add on this wonderful technique. And maybe that if you are able to gather all the technology that it is available there for us now, maybe we can take biology really to the next level. We have a couple hundred of cases now done, and we are really very satisfied with this technique. For instance, one of its main indications is when you have a root fracture, as in this case, and you have to extract the tooth because it's fractured. It must have a sound endodontic treatment, and you just cut part of the root. Now we're able to do it a lot better because there are appropriate tools to do it, like the PET kit from Brasseler. You can cut much more easily the root. And then you just prepare the site as if it was for a regular implant placement, a post-extraction implant placement. In our case, we're using the endoret graft, and we place the implant, and we almost always do the provisional at once. But before doing the provisional, we are using an intermediate abutment, which is called unit, and we won't have time to go into the details of this abutment, but it's awesome, absolutely awesome. So we put this intermediate abutment at 35 newton centimeter. It's torqued to the implant's neck, and then we build our provisional from there. And you can see how healing occurs. This is actually the same day, and then you can see it 7 days after surgery, which is amazing. And this is why we're utilizing almost always this technique, the socket shield technique. But the thing is, as we went through a lot of cases and we started to do a lot of cases, and as I mentioned, we have more than 100 cases now, we started asking ourselves the question, well, why is it we are doing a provisional restoration? Is there a point in doing a provisional restoration? Well, we were not sure of that. And so let me show you another wonderful case. And you have a root that you're going to be also extracting. And this is a very delicate procedure. So it's like there is a learning curve to it. Okay, it seems simple, and it really is simple, but sometimes it's much more difficult than extracting the old tooth. And as I told you before, now we start to have tools as the wonderful, because it's amazing, the Brasseler kit for PET. So Brasseler developed, together with Atlanta team, they developed a kit which is absolutely amazing for you to take good care of the root that you're extracting, and also of the buccal shield that you're leaving in the post-extraction socket, as you can see here. So it's wonderful, it's delicate. It's up until you then reduce the shield up until a thickness of 0.5 millimeters. That's what we're doing now, and you're now ready to pull out the rest of the root, the part that you're not going to be utilizing. Sometimes it's not as easy as it sounds. We should say so. So that you understand that you really have to be delicate, okay? Just probing to see if you have a stable shield, because it's so important, and then you do just the preparation, the socket preparations, as if you were placing your regular implant in a post-extraction gap. We use low rotation because we collect so much bone by doing it. And then we put the implant in, as you're seeing. And after placing the implant, we put it well under bone, well under bone, as you'll see. And after that, we're using this unit abutment, which is amazing also. And you'll see later the details. And you torque it 35 Newton centimeter. You can then make your impressions. That's the point where you make your impressions, okay? And you must do it before you put anything into the post-extraction gap. Then you put the healing cap. You've done already the impressions. You put the endoret graft. That's what we're using with all the autologous bone that we also collected from the socket preparation. Just put in the endoret graft, as you can see, and meanwhile we're obtaining a model, the cast, to go to the lab technician. And using the Zirkonzan software, we're designing and fabricating on the same day. We're designing. This should be done very, very carefully. We design our crown, and it's done the same day. Our zirconia crown with a metallic interface. So you should do direct zirconia and screw it into the implant. And you design it and fabricate the same day, with the advantages of having zirconia also on the soft tissues, because as we well know, it's so prone to the connective tissue attachment and to the soft tissues. And this is it. So in one appointment, in the same day, well, you can provide your patient with its final restoration. Well, it's such a comfortable procedure for your patient. Well, that you actually, when you think twice, you think that is the kind of procedure that you want to provide people you love. Like if it was your father or your mother or your brother, well, that's the kind of procedure that you would operate on them. And in this particular case, by a matter of chance, we're talking about my dearest brother, okay? My dear brother Mario. Well, and the thing is that I had placed implants before, as you could see, because we have a distal implant in there, the molar. And what he told me is, come on, Felipe, this is awesome. It's nothing to do with the other procedures, the other implant procedure that you've done on me. So it was really incredible. And this is 1 year, almost 1 year healing, and it's amazing. The volume and the contour of the soft tissues that you were able to maintain, and the aesthetics, and with an incredible comfort for your patient. This is really, really amazing. It was based with this Marcus Ursler technique, the socket shield, because you can fool your body telling it the tooth was not extracted, because you leave that fragment, that so important fragment. And also you can bring in all the technology that has been developed as this unit, which is suited for single crowns, that allows you to have bone well above the micro gap. We're talking about 3 to 4 millimeters, as you can see in this X-ray, well above the micro gap. And this is because you have a zero micro gap, you have zero micro movements. Also, you have a controlled roughness of this abutment, which allows and is designed to establish a very strong connective tissue attachment. And also, it will provide bone osseointegration. And also, its roughness, it's controlled in such a way that plaque will accumulate a lot less than, for instance, what happens in a ceramic surface. And this is something that is well worth a more detailed explanation, but we won't get into that in this presentation. So you could also bring all the technology that the CAD systems, the CAD CAM systems are making available for us today. The zirconzan, you have precision and establish the emergence profile. This is awesome. And you have the right material, in this case zirconia, and it's milled, because when it's milled, soft tissues will attach in a much easier and stronger way. And you have also the speed to do it same day with incredible aesthetic and biological results. Well, we can't turn our backs into this kind of advantages. And well, this micro gap under bone concept, taking big advantage of the socket shield technique and big advantage of technology, and provide you with a virtual one-piece implant enhanced by bone, well, it's really something that we and our patients are enjoying a lot. Well, thanks for being here with me and standing with me. Well, I hope to see you soon here on Dell XP. Thanks a lot.